Kyla Herman's 4-year-old daughter is currently in critical condition at Alberta Children's Hospital, and that's where Kyla joins us now. And let me begin by asking you how your daughter is doing this evening.
She's doing okay. While the IVs are in her, she's doing much better than when they're not. But we are waiting for her blood count numbers to get where they need to be. So as right now, she's on the critical watch list. So we're taking it day by day with how she is.
There was a period of time when she was at home and infected, and you didn't quite know what you had on your hands. How sick was she at that point?
She was very sick. It started on last Thursday with a fever of 102. And then symptoms started, more symptoms started Saturday. And then by Saturday evening, she was in the bathroom every 30 minutes. By Sunday, she was in the bathroom every 5 minutes. Some instances, we couldn't even finish washing our hands before we were back using the washroom.
Agonizing for her, but also, I mean, I can't imagine what it's like to see your child going through all of that. And then at some point, you made the decision to take her into the hospital. Tell us about that.
Right. So when she first got sick, we figured it was just the new start of a new school year, and it was just your average flu bug going around. It wasn't until Sunday evening around 7 o'clock that we got notification that it was, in fact, E. coli breakout with Fueling Brains schools, daycares. And at that point, we made the decision to take her in and get her checked out.
Have you heard from the daycare at all?
They are currently sending out 2 emails a day. I did get a call from Cameron's director directly from her a couple days ago, just checking in on how she was.
And so we don't yet know exactly how this infection began, but what would you like to hear from the daycare?
I would like to hear them take some accountability and responsibility for the situation that they've put us in and many other kids and families. I'd like to hear an apology. Not that it's going to change the outcome, but it would give us some peace of mind that they actually acknowledge that of what we're going through.
It's a terrible thing you and many other parents and children are going through. It sounds, though, maybe, is it possible that your daughter is getting better?
She is. So actually yesterday, her blood work came back all looking good. So they removed her catheter and took her off of her IV fluids. But a couple hours after that, she just started to decline, and her blood work came back with numbers going in the wrong direction.
Wow, a difficult time for so many people in Calgary, and we wish your daughter the best and appreciate you giving us some time this evening. Thanks, Kyla.
Thanks so much.
Let's get a doctor's perspective now on the dangers of this strain of E. coli. Dr. Stephen Friedman is an emergency physician at Alberta Children's Hospital in Calgary, where Kyla's daughter is right now. Dr. Friedman, let's begin with this. Give us a sense of the magnitude of this outbreak.
This is a very large outbreak. It most likely is the largest single-point food exposure outbreak in children under 5 years of age recorded. It is stressing the healthcare system and really has led to the sudden creation of new clinics across the city that are dedicated to the care of these children, seeing anywhere from 40 to 50 children a day with sugar toxin-producing E. coli infections. So this is a very large outbreak.
As I understand it, the initial point of contact is believed to be, though not confirmed, to have happened on September the 1st. Why are we still seeing fresh cases?
Well, children who are exposed to Shiga toxin-producing E. coli, many develop symptoms within days, but some children can develop symptoms out to 10 days after the exposure. And the other really important piece to note, and something that we're monitoring for, is secondary transmission. So approximately 10% of children infected with Shiga toxin-producing E. coli will transmit that infection to a household contact, most commonly siblings, unfortunately. So if there is a delay in the initial symptoms, following by a delay in the symptoms in the second infected individual, that can lead to symptoms presenting anywhere from 10 to almost 20 days after the end of the exposure of the first person involved.
We all have a sense that this is a very serious thing that's going on here, but from a doctor's perspective, describe for us how dangerous potentially this is.
Well, I mean, first we have to realize that children who are infected, even those who just have the enteric symptoms, so the diarrhea, the bloody diarrhea, the abdominal pains, it's incredibly distressing, as well as for their parents, because many of them, and they're all explained that there is a risk, about 10 to 20% of developing the hemolytic uremic syndrome. So that's kind of a constellation where they develop anemia as well as kidney failure. So this is really a scary illness. And even the children who do well, the 80 to 90% that don't develop any of these complications, we do monitor them very closely. So they come back daily for blood work to monitor their kidney function, their hemoglobin to make sure they're not developing anemia or low platelets. And many of them usually get intravenous fluids at those visits.
I know this is a rare event, though serious and widespread. I know that it is, we don't yet know exactly how it started, but at this point, are there any lessons here for people?
You know, it highlights kind of the potential risks and pitfalls when you have one location serving food to many individuals, and it highlights the importance of the standard kind of public health prevention and food safety measures that we're all aware of. You know, really these include and start with, you know, the fact that we know that STEC and other foodborne pathogens can get onto food on the outside of produce, vegetables, fruit, as well as onto meats through contaminations through the slaughter process. And so it's really important that, you know, vegetables and fruits that are served raw are really meticulously cleaned, and anything that is cooked needs to be heated properly and appropriately to a temperature that'll kill and eliminate the bacteria. And so that really is the ultimate lesson, no matter where we are, that doing these things properly and not cutting corners and making mistakes is paramount to the health of our population.
I know you're very busy, and I so appreciate the time you've given us this evening. Thank you very much.
My pleasure. Thank you.